Diagnosis in orthodontics. The diagnosis in orthodontics is resemble the diagnosis in medicine and dentistry, which follow the problem-oriented approach. The problem-oriented approach include the steps of collection of the truth or the problems of the patient in three steps, which include the questionnaire and interview or the case history, and then the second examination and the diagnostic record or diagnostic aid, which include the essential and non-essential diagnostic record. For in the diagnosis procedure, the primary task of the dentist or orthodontist is to collect the truth or they collect the database of the patient in a comprehensive manner, and uh, then orient these data or these data which executed or collected from the questionnaire and interview and the clinical examination and the diagnostic record in a problem list, and this problem list which with the perception of the patient will be oriented in a manner that give a good treatment planning. The questionnaire and interview include the patient name in addition to the address, occupation, his chief complaint. The clinical examination include the extraoral and intraoral clinical examination, and the diagnostic record include the essential diagnostic record or the essential diagnostic aid, which are the questionnaire and case history, clinical examination, study models, radiographs, and photographs. The non-essential diagnostic record or non-essential or supplemental diagnostic aid it include the hand-wrist radiographs, other radiographs which include CBCT, occlusal radiographs, periapical radiographs, myographs, etc. For the questionnaire and interview in the our clinic or Evansina medical and pharmaceutical science college of dentistry, we make an orthodontic clinical case record of many parts. The first part include the questionnaire and interview, which include the patient name, age, gender, phone number, occupation, address, maternal status, referred by and the chief complaint of the patient. In the questionnaire and interview part, we ask the patient for his name. The name of patient is important for the communication with the patient, and when the dentist or orthodontist remember the name of his patient in the consequence visit or inactivation visit, the patient will be more comfortable with his dentist and more familiar with the orthodontist when he remembered his name. The address and occupation of the patient is important in deciding which the suitable orthodontic appliance that required for the patient. For example, when the patient have an address far from the clinic, the appliance will be different from the patient that near the location of the clinic. The occupation and socio-economic level is important in an examination. The attitude and compliance or cooperation of the patient. When the patient have a good socio-economic level, the appliance designed for the treatment is different from the patient with low socio-economic level. The contact information include the phone number, the email address, other social media address is important for communication with the patient during the activation visit and the follow-up after the orthodontic treatment. The age and gender of our patient, there is a different terminology for the age of the patient. one of the terminology of the age of the patient is the chronological age. The chronological age of the patient means the age of the patient from the day of the birth of the patient until the day of the visiting of the dental clinic. In addition, we divide the age of the patient according to the dentition of his patient to the primary dentition age, mixed dentition age, and early permanent dentition age. The developmental age or the skeletal age of the patient is meaning the maturation of the bones of the patient, and this is estimated according to the hand wrist radiographs. There is no correlation or not a clear correlation between the chronological age and developmental age or skeletal age of the patient. Some patients have for example, a 10 years old of chronological age, but his developmental and skeletal age is beyond the 10 years old or under the 10 years old, and there is no clear relationship between the chronological age and the developmental or skeletal age of the patient. In addition, the age is correlated with the gender of the patient. For example, the female patient have an earlier maturation in age than the male. The orthodontic treatment, for our patient can be done at any age, but the golden age for the performing the orthodontic treatment is between 10 to 13 years of the female and 11 to 14 years old at the male. In addition, the gender of the patient is different in the treatment planning for the male than the female. For example, the female seeking for aesthetic, facial aesthetic more than the male. The past dental history is taken from the patient during the questionnaire and interview of the patient. The past dental history include the regular dental care or regular visit of the patient to the orthodontist or the general dentist. And this gives an indication for the attitude of the patient. When the patient have a regular dental care or regular dental visit to the dentist or orthodontist, that means the patient have a positive attitude and there is a good motivation of the patient for seeking the orthodontic treatment. In addition to the past dental history, if there is any extracted permanent teeth of the patient and its effect on the planning of the treatment of orthodontic treatment. In the past dental history, we ask the patient if there is any prenatal and postnatal history. That means any delivery problem, for example, the delivery of the child by using of the forceps may affect on the temporomandibular joint and cause trauma the temporomandibular joint and asymmetry in the growth of the mandible. In addition, if there is any congenital anomalies in the patient due to the effect or drug effect on the pregnant woman or on the pregnant mom that causing born of the child with congenital anomalies. The postnatal history include the type of feeding when there is a natural or breastfeeding of the patient give the breastfeeding effect on the development of the maxilla and the mandible. In the natural or breastfeeding children, the development of the maxilla and the mandible follow a natural developmental curve, while the artificial or bottle feeding, the child have a small maxilla and a small mandible or underdeveloped maxilla and the mandible. In addition, if there is any bad habits like thumb sucking, nail biting of the child, that may affect on the occlusion of the child and cause many problems such as open bite or cross bite. The medical history, one of the important medical history of the patient. If there is uncontrolled epilepsy of mental retarded patient and he is need for a special care or a special management during the orthodontic treatment, in addition to the hemorrhage disease, well, the using of the appliance may affect on the bleeding of the gum and increase the bleeding of the gum when there is an hemorrhage disease, for example, the hemophilia. The chief complaint of the patient mean the word of the patient that seeking for orthodontic treatment. And most of the chief complaint of the patient that attend the orthodontic clinics include the aesthetic, and then the functional, and the others. The others means the interdisciplinary treatment or interdisciplinary chief complaint. That means the patient referred by the other specialist dentist, such as the conservative dentist or periodontist or prosthodontist, for orthodontic treatment before perform the prosthodontic or periodontic treatment. Thank you.